Being part of the funding of the Asian Pacific Hub, I believe its research has helped examine how developed and developing countries must work together, go beyond nationalism, and cooperate. No man is an island. We have to help each other to contain the pandemic together and to share information and technology for disease prevention and management. The COVID-19 pandemic has changed the expectation of how fast scientific breakthrough can be applied to pandemic containment and translated into value for the patients and society. The containment of COVID-19 pandemic may be divided into two phases. Phase one was before the vaccine was available in November 2020, when stopping the spread of virus was most important. Non-pharmaceutical intervention, NPIs, have been used to interrupt the transmission of virus domestically and internationally. Smart technologies, such as big data analysis, 5G wireless system, cloud computing, information communication technology, Internet of Things, and artificial intelligence all have been used for the epidemic prediction, border control and quarantine, hospital infection control, telemedical care, contact tracing and testing, home isolation and home quarantine, QR code aided entry of public places in many, many countries in Asia Pacific and other regions. In the phase two of pandemic containment, immunization plays a pivotal role in addition to non-pharmaceutical intervention. It is really amazing to make a vaccine available within 10 months through the integrated efforts of public-private partnership. New platforms have been used to develop DNA vaccine and adenoma vaccine, and emergency use authorization was adopted by national regulatory agency to accelerate the special approval of vaccine. Vaccination is most important as we learned how to live with the virus and as COVID-19 becomes a less severe disease when vaccine coverage is high. For vaccinating our way out of the pandemic, it is essential to enhance development, manufacturing, distribution, and acceptance of vaccine in Asia Pacific. Among all the challenges facing the global COVID-19 vaccination effort, inequity is perhaps the biggest one. According to the statistic of our work in data, analyzed by the Oxford Martin School, 49% of world population has received at least one dose of a COVID-19 vaccine. 6.9 billion doses have been administered globally, and 26 million are now administered each day. However, only 3% of people in low-income countries have received at least one dose, and less than 6% of Africa's population of 1.2 billion has been fully vaccinated. Last month, President Biden convened a global COVID-19 summit on the sidelines of the United Nations General Assembly to urge action on three priorities: enabling global vaccination, ensuring equitable access to oxygen tests, personal protective equipment, and therapeutic, and strengthening our collective ability to detect and respond to the next infectious disease outbreak. No country can fight COVID-19 alone. Helping developing countries reach vaccination coverage is paramount. We must reduce nationalism and collaborate with WHO, COVAX, and Gavi. Economic revitalization is as important as pandemic containment. Finding innovative policy and private sector solutions to public health challenges are very important. We have to establish a resilient global supply chain to maintain the momentum of economic growth. Can the accelerated pace of digital industry e-health and biopharmaceutical progress be sustained in the post-pandemic times? I believe it can, but it will require new levels of trust and collaboration between government and industry. In order to enhance resilience in public health, we have to make health system more accessible, affordable, effective, and sustainable. In this unique globe, we have to promote human health, animal health, and environmental health together as a whole. The one globe, one health may become the theme for the reform of resilience in the post-COVID era. I think today's discussion will cover all these aspects. So let us welcome all panelists and look forward to a very successful and fruitful global event. Thank you very much.